Hi everyone, my name's Rick Wersh and this is my week 2 musculoskeletal SOMO. So I have JK that came into the clinic, an 81-year-old Caucasian American. He came in alone and is a reliable historian with a chief complaint of thinking he had a gout attack in his left knee from eating pinto beans in New Mexico. So it started a day ago during the middle of the night, woke him up. It's in his left knee, and it's been going on for just one day. He describes it as aching and burning. Uh, Nothing really makes it better or worse. He can't take Tylenol because of his kidneys, uh, but hasn't stopped him from doing any of his ADLs, and it's not worse during the night or during the day. So his medical history includes stage 4 kidney disease that he sees a nephrologist for, hypertension, neuropathy, GERD, and hyperlipidemia. He hasn't had any hospitalizations or surgeries. And he's not allergic to anything. So medications includes allopurinol, 100 milligrams Monday, Wednesday, and Friday that he's worked out with his nephrologist. Aspirin, 325 milligrams daily. Atrastatin, 80 milligrams at bedtime. Gabapentin, 300 milligrams at bedtime. Metoprolol, 25 milligrams, and Tums as needed. His mom died of a heart attack at 74. His dad died at 72 of frailty. Doesn't know his grandparents' history. He has a son that has gout and a sister that has gout. So, for review of systems, he denies any recent fevers, chills, fatigue, or weight changes, no shortness of breath, chest pain, or leg swelling. For respiratory, he says he's had a cold for 2 to 3 days, so like a day or two before the gout attack happened. And he still has it. He's wearing a mask inside the clinic. So for social history, he's married. He owns a house that him and his wife live in, and there's 2 steps to get into it. And since he's uh, over 80, it's important that we know that he's able to do his own ADLs, which he can. He never drinks alcohol or eats chocolate because he knows that those can cause gout. So for vital signs, heart rate is 74, blood pressure 142 over 80, temperature was 98.4, respiratory rate 15. He's 5'7" with a weight of 148. That puts his BMI at 20. His height is 5'7.5" with the weight of 148, which puts his BMI at 22.84. He's statin at 96% on room air. So during the physical exam, he's sitting in the chair comfortably, no acute distress. Respiratory, he does have some clear discharge coming from his nose, but clear breath sounds bilaterally in all lobes. When musculoskeletal, looked at his knee, it's red, swollen, warm, with a little nodule off to the side. His heart rate is strong, regular, no extra heart sounds heard. So for differential diagnoses, I got gout. So given that he has a history of gout and a history of high uric acid levels, that he's been working with his nephrologist to keep those down. Um, he also has a family history of it and an upper respiratory infection right before, which can trigger gout. So the next differential diagnosis would be pseudogout, calcium pyrophosphonate de- deposition disease. So, given his age and the sudden onset, can be likely. It's less likely because he has a history of gout with the high uric levels. But the treatment for both of those would be the same. So, can't miss diagnosis would be pyogenic arthritis or a septic knee. Uh, it's less likely that this is the case because he's able to bear weight on it and do all his own ADLs, and he doesn't have a fever or body aches or chills. So the primary diagnosis is going to be gout. For the history of gout attacks, the family history of gout, the history of high uric acid levels, and the upper respiratory infection. So the test plan would be to aspirate the knee for the synovial fluid to confirm the diagnosis of uric acid levels in there. You can also draw blood to confirm those levels and to rule out other systemic disorders. So it could help rule out the septic knee. The treatment is going to be prednisone 50 milligrams for 5 days and then 25 milligrams for 6 days in the morning. Take it with food. He can't take any NSAIDs or other pain relievers just because of his kidney function. He can't drink extra fluid because of his kidney function. We're going to educate him to avoid trigger foods, lifestyle modifications or changes, avoid trigger foods, and follow up if he's not able to bear weight on his knee or develops a fever in the next couple of days, and to go to the emergency room if he has trouble breathing.